Hey.
Hello.
Hey. Good to see you. Come in.
Good to see you. Who's this here?
This is Hazel.
Oh,
Say
she's
hi
so
there.
cute.
Hey, say hi, Hazel.
Hi, Hazel. Alright, so do you want to tell us a bit about yourself?
Oh yeah. Well, I'm Solomon, and I'm a psychiatrist, and I've got a family. Oh. And this is my father-in-law.
Yeah.
Oh. Mm-hmm.
And how long have you been a psychiatrist for?
I've been a psychiatrist now. Oh, good question. It's been so long. Qualified about 12 or 13 years ago. 13 years ago,
Okay.
roughly.
And where did you study medicine?
I studied in UWA.
So that's the University of Western Australia?
Yeah, you want a drink?
Sure. Some water will be fine.
Yeah, University of Western Australia, and in those days it was a 6-year degree.
Wow. Okay. So, how long ago did you graduate from high school? I mean, what year did you graduate from
You're
high
trying to
school?
work out my age.
No, not. I'm just asking because it has changed since then.
Yeah, so what was the question again, sorry?
What year did you graduate from high
What year
school?
did I graduate? Oh, okay, 96 from high school, yeah.
Okay. So the universities for
That's 1796.
the universities in WA have changed quite a lot since then for
Yeah,
medicine.
so that was a 6-year undergrad degree back in the day.
Yeah, and did you enjoy medical school?
That's a very good question. Honestly, when I first started medical school in the first year, it was really, I want to say boring, but maybe because well, back in the old days, I think the curriculum's changed, but back in the old days, in the first year, you would do things like dissect pigs and learn about biomorphology, which is like basic biology. We did physics in first year. Anyway, it didn't really feel like I was studying medicine at all. And by the end of first year, I actually wanted to quit. So I told my dad I wanted to do law, and he yelled at me.
Okay.
Which was good, because I actually really enjoyed the rest of medical school. Once we got to fourth year, you go around the hospitals.
So you enjoyed it from fourth year onwards or from like second year?
Probably more from fourth year onwards. Yeah.
Okay. And so how did you hang in there for the first 3 years? What made your mind like that you wanted to stay in it?
Well, my parents wouldn't let me change, to be honest, which turned out to be for the best, really, because I love what I do now. But the first few years, I just sort of aimed to pass, really. I wasn't really the best medical student, in all honesty. I just sort of got by, enjoyed university life.
So if you could do it again, what would you have changed about your experience or
Oh, if I could do the whole
Medical
medical
school.
school again, I'm not sure, because in those days we didn't have we didn't really have much of the internet, so you were relying on the lecturers to sort of teach you, and honestly a lot of the lecturers weren't particularly interesting in the way they presented the information, and also then you had to read from textbooks. I found it hard. There's so much information in medical school, like ridiculous amounts of information that you have to learn. So I found it challenging to read. I found it very dry. It was difficult to soak up the information. So I spent a lot of time learning mnemonics, memory techniques to try to remember things.
And did you find that helped you?
Oh yeah, because for example, microbiology, which was one of my weaker subjects, I basically needed to convert everything into mnemonics, into pictures. Yeah, so
Okay.
yeah, so I had to do that, and so I spent a lot of. I took, in those days you'd go to a library and get all the books out.
Yeah.
So I would take out all these books about memorizing and learning how to learn things. So I spent a lot of time just learning.
Yeah. Learning how to learn.
Learning how to learn. Actually, that was actually my my major.
That's fair enough. And
Oh, I did really enjoy reading Kaplan and Static, which is a psychiatric textbook. It was the only textbook that I really read properly. Really enjoyed that one. That was in fourth year by the time we read that.
so I think the thing about being a doctor is that you're continually learning, and you have to really learn how to learn so that it will make it easier for the rest of your life.
I think that's true because you can't know everything all the time. There are some geniuses out there that do have like really amazing memory. So there are a few of them in medical school that just like, I don't know, they've got different brains or they just study that hard that they seem to know everything.
Or they're just super passionate.
Yeah, either very passionate or they just have better memories, better long-term memory than I do. I found that, I was good at cramming for exams, but in terms of long-term, keeping the information long-term, there's just so much of it. It's really
Would you say that the information is super difficult conceptually, or is it just that
No,
there's so
I
much
found
of it?
medical school, it wasn't difficult in the sense of like,
Oh, I just don't get it. Yeah.
It's just, you just have to
really work.
It was just
and keep up
mainly
with
memorizing.
keeping up with everything.
Mainly memorizing. So, like in high school, it'd be similar to what you do in human biology,
But just the giant version
or just
of that.
history, or like when you study history, you just have to learn like a million facts.
Yeah. So, speaking of learning how to learn, if you could go back to high school or even your time in primary school, would you have done anything different? Like if you knew you wanted to be a doctor?
Oh, would I've done anything different? It's really hard to say.
Yeah. Did you know you wanted to be a doctor since you were young?
No, not really. I thought I wanted to be a computer programmer.
Okay.
When I was growing up, but when you're a kid, honestly, I think asking a kid what they want to do is kind of
absolutely
difficult. Unless they want to be a pilot or something like that, where a lot of the
practical.
I know that a lot of people that want to be pilots knew from very young. I think even within medicine, the great thing actually about medicine is that there's so many career options within medicine. So I think regardless of your personality, if you do medicine, you could probably find something that you like. So for the more introverted people who don't really want to talk to people, they can do pathology or radiology. And if you're really like, spending time with people like myself, then psychiatry. If you're good with your hands and you want to do more hands-on work, then you do procedural work like surgical stuff.
Okay. Yeah. So if you wanted to sell psychiatry as a field that people could possibly go into, like a car advertisement, how would you? Like, I don't know, like a house.
You know what? I would say it's not for everyone. Like every specialty is like that. It's not for everyone.
Can you sell the
But
pros?
in terms of like why it's so great, for if you're sort of built like that, I think the great thing is from my point of view, it's very holistic. I think of all the medicine that I've done, I find psychiatry the most holistic.
So you're seeing the person as a whole.
Yeah. So you have to know a bit about their medical surgical history and their medical surgical problems, the meds they're on, the social context, and then when you're treating in the psychiatric model is the biopsychosocial model. So you're looking at all the different elements, and including the background history, the personality. So you're really looking at a person, in a very sort of holistic way. And I found that in other, and this is not to dismiss other specialties, because other specialties are great as well. But for me anyway, I found that like if I was doing, pick a specialty like cardiology or gastroenterology, you're looking very narrowly as a specialist at one organ. In psychiatry, it's not really like that. You kind of have to think quite broadly. Yeah, so that's what I really like.
But we need both in medicine.
Yeah, of course. And like I said, it's not for everyone. So some people would hate psychiatry. That's fine.
Why do you love psychiatry then?
For me, I really feel like it's a calling. From a spiritual point of view, it feels like it's a calling. From a intellectual point of view, I think I never get bored because people are never boring. Like you're always meeting people and you get to know them in such intimate, deep ways.
Yeah.
You really spend so much time with people, and when they're seeing you, they really just talk about if you're doing a therapy, right, they're talking about like the most important things to them. And they're telling you stuff that they may never have told anyone else about. That's very common in psychiatry. So
you think you're in a very special position where people are going to tell you about the most vulnerable parts of their lives?
Well, you could put it like that. It's more that you just get to know people authentically very deeply. And you help them in a very, I'd like to think, in a very deep way. So one of the things is you really, if you're good at psychology or psychiatry, I'll put this kind of overlap there. One of the big things that you do is listen. And that sounds ridiculous, like of course everyone can listen, but if you really listen, you have to listen to what the person is really trying to say.
Yeah.
It sounds easy, but it's not. And everybody wants to be heard. Like I don't know anyone that doesn't want to be understood.
Yeah.
Everybody wants to be understood. And that's probably the biggest thing that you bring in psychiatry, is that you really listen and you make people feel understood if you're good at your job. And then, thankfully, we actually have some treatments that actually work.
Yeah.
So what I love about psychiatry is that actually, for most disorders, we actually have a very efficacious, or, you would use the word effective treatment.
Yeah.
I think it's a myth that psychiatric patients never get better. In fact, they all get better to an extent.
Yeah.
So that's something that I really love about psych.
Yeah. So what would you say are the downsides, or like why not all people would fit into this role?
Yeah, I mean, some people don't like spending time listening to people. Very hard if you don't, I suppose if you don't really have great interpersonal skills, you probably wouldn't like psychiatry. Some people they want to fix things. So if you're like quite mechanically minded and hands-on and you just want to get things fixed, psychiatry would be very frustrating, because human beings are generally not that simple, and you can't just tell people, get over it, or get out of that relationship,
because it's all mental.
It's that people hate being told what to do. So I think sort of like having a very strict medical model doesn't really work. You can't just give hi Hazel. You can't just give people instructions.
Yeah.
So I think if you like to do that sort of medicine, psychiatry is not really like that.
Okay. And how would you say a common thing people don't really understand sometimes is the difference of psychiatry and psychology?
Oh, sure. Yeah, so I mean, psychiatry, we train as medical doctors first, so you do the same training as every other doctor that does medicine, which gives you a sort of a good understanding of the human body and medications and pathology and all that stuff. And you also get to know how different specialties work
together.
And what they do. Psychology is, I don't want to speak, I'm not a psychologist, but from what I understand, obviously they do a Bachelor of Psychology where they're focusing on psychology from the very beginning. And then in Australia, at least, most of them will do a Master's in Clinical Psychology by the time they're working as a clinical psychologist.
Yeah.
So they're not doing the medical side so much, but they have, I don't want to be controversial here, but obviously they have, more training in therapy. Our training in therapy is limited in psychiatry.
Yeah. But
we do get some training, and so you understand things like CBT, IBT, the usual therapies. Yeah. And
psychiatrists prescribe medications.
Yeah, I mean, if you want to simplify to that
stuff.
point.
Yeah.
You prescribe medications in the medical system. If you're going to admit a patient, also you're in charge of that patient when they're in hospital. And generally speaking, in the Australian context, it's psychiatrists that do the diagnosis as well.
Yeah. And how would you, if someone was interested in this kind of area, like psychiatry, psychology, the brain, all that, how would you distinguish if they're right for psychology or psychiatry?
Oh, you mean between the two?
If they're
that's a good question. Well, okay, so one of the things is, like I said, in medicine, when you're going into medicine, a lot of people aren't going into medicine thinking, I want to do psychiatry.
Yeah.
I think, like I said, the beauty of medicine is that you kind of discover, in a way, what you want to do, because it's so broad. I think if you're very clear that you want to do therapy, then you might go into psychology straight away.
Yeah.
And that's fine. I mean, I'm not really sure how you could differentiate too early.
Yeah.
I think most medical students, I'd say, unless they knew they wanted to become like a dermatologist or like some specialized field straight away. And again, I don't really know how people would know enough about that specialty to go, I want to do that.
Yeah.
Until you actually work in it. So I think most of us will find our path as we're working.
Yeah.
But yeah, I mean, I think if you're post-grad and you've already worked in the world and you know a bit more about the world and you understand a bit more about the medical system, you might already know what specialty you want to do.
Yeah.
But for a lot of the undergrads like myself, we kind of figured it out as we went.
Yeah, so...
And changed our minds several times in the meantime.
So how would you say your mindset was when you first went into medical school? What did you think you would be doing, or what did you want to do?
That's a good question. I had no idea,
Okay.
Because I think most people, like, our experience with doctors is like going to the GP.
Yeah.
So thankfully I didn't have like major medical illnesses when I was growing up. I had no idea what a psychiatrist was. Like, no idea.
Yeah.
I'd never seen one.
Never heard of one.
Never heard of one.
Yeah, that's fair enough.
Never knew one.
Yeah.
So I had no idea. Literally had no idea. It's only when I, like I said, read the Kaplan and Sadok book and I thought, this is amazing. This is so interesting. OCD, whatever.
Yeah.
There's all this stuff and I was like amazed by it. That's when I got interested in it. But yeah, no, I had no idea. And I think it's okay. Like when you're 16, 17,
I'm sure
15,
that some people are happy to hear that because
honestly,
they have no idea.
You don't need to know what you want to be,
Yeah.
for the long term. Most people will figure it out later. And also in a lot of careers, you actually change career paths
Yeah.
quite a lot as you go.
Do you want to go out? Okay. So, how about once you started rotations and going around with different kinds of doctors?
As a
medical student.
As a medical student? Oh, yeah. So, yeah, I can talk you through the... so, in our training, and it might be all quite different now. So, when I did it, it was the first 3 years was basically like a science degree.
Yeah.
Probably more content heavy, but a lot of it was basic sciences. That was in UWA for the first 2 years. And then the third year we went to QE2.
Okay.
Which was actually...
a hospital?
Yeah, so just attached to Charlie's.
Yeah.
And I still remember Barry Marshall's BMW.
Yeah.
So,
that's pretty cool.
Yeah, so the Nobel Prize winner guy. And so we were at... so we were in QE2. And then it was just in those days it was 120 of us just going to lectures.
Yeah.
And third year was a very busy year. We did pathology, pharmacology, microbiology, so that was all the sciences, and it was becoming a bit more clinical. We're starting to study pathology. I still remember Robbins, which was a big textbook in those days. And then we always read the small one, by the way. It's easier.
Like the condensed version.
Yeah, the condensed version. And then in fourth year we were sent to the hospitals, and then you'd go to, and it really depended on which term you were doing. Some of them were super interesting. Some places, and you just attach to a surgical team, you go to a medical team, and you get a good feel for all the different parts of the hospital. As a medical student, in those days, a lot of the time you felt like the third wheel though. Sort of just, you're kind of getting in people's way a lot of the time. So you're just standing around awkwardly, getting tutorials. One thing that I realize now, having been in medicine for a long time, is that I didn't take people's time very seriously because I didn't take my own time seriously. And if there's something that I could change now is to appreciate people's time, because when you're working, especially as a registrar, you're really busy.
Yeah. And
to actually take the time out to teach a medical student, and especially for the consultants, to take time out to actually teach medical students, that's a privilege to learn from those guys. And I didn't appreciate that as an undergrad.
Yeah.
I was childish and immature.
Okay, so if we go back even a little bit further, what drew you to medical school in the first place?
My Asian parents.
No, like for real. I don't think your parents, did they like impose it on you, like you have to do medicine?
No, they didn't. Honestly, it was, I didn't know much about medicine. I knew I liked science. I really liked science. I'd always read science books when I was growing up. And medicine was a bit sciencey. But honestly, I had no idea. I had no idea I wanted to do medicine.
I think you would fail if that was an interview question. So why do you want to be a doctor?
Yeah,
I like science.
Yeah, back in those days, I had
Yeah.
no idea what I wanted to do.
Okay.
I thought I wanted to be a lawyer because I read John Grisham. I mean, come on, the data that I had, the information that I had was pathetic. So I knew about law because of John Grisham,
Yeah.
the novelist, and I knew about medicine from going to see the GP. I mean,
Yeah, that was it.
and I think even in those days, I'm not sure even whether ER was even out yet. So it wasn't like we were watching ER and it's, you know, I wasn't even inspired by any particular doctor or anything like that.
No, okay.
So it's okay to not have an idea.
Yeah.
And
And there's
to
so
be
much information
inspired.
out there these days.
Although I understand that getting into medicine now, you have to sound like you really know what you want to do.
Exactly.
But for me, I had no idea. And I mean, to be really honest, in those days, it was just like, you know, in terms of like, it was just like based on your ATAR score essentially. And it was like medicine was the hardest, dentistry. I knew I didn't want to be a dentist. I didn't even put that down. But I think I put medicine, law, and commerce in that order.
Okay.
Yeah. And so if I didn't get into medicine, I would have ended up studying law. Yeah.
Yep. Okay. So, sorry, I think going back to that other question, what I meant about the rotations was like when you started going around and trying different fields of specialties of medicine, what did you think you wanted to do? Like, was it pediatrics or what?
When I was doing pediatrics, I thought I wanted to be a pediatrician. When I did ED, I thought I wanted to become an ED doctor. When I did cardiology, I thought I wanted to be a cardiologist. more so when I was working. So I think working was way better for me because in medical school, I think as a sort of a lazy male, until I got responsibility, I just couldn't get into it. Yeah, I couldn't be bothered. I didn't know why I was learning anything. My motivation levels were pretty low in med school, to be honest. I just didn't see what I was trying to achieve.
Okay.
Then when I started working, it's like a switch turned on, and I went to my internship. And then it was everything was just interesting. I loved it. I really loved being a junior doctor. You'd rock up. You'd get 5 rotations in a year, and you'd do 10 in Charlie's. We did 10 weeks each. Yep. And you do general surgery, general medicine, ED. I think I did psychiatry in my first internship year. Really sorry to forget the last one, and then some other term. But anyway, you do all the sort of the usual ones, and you get a really huge, different experiences. It was never boring. One thing I really loved was working with registrars and consultants. I think one thing about medicine is that the people that are working in medicine generally are really clever people. And I was always inspired by their cleverness. I was like, what? How do you know that? That's amazing. Yeah. So I was like really taken aback by all these clever people. And then I think being in that environment makes you want to be like knowledgeable. Study harder. And I think and you learn a lot by osmosis and asking questions. So I learned a lot just asking questions. The registrars that I worked with, most of them were just amazing people. And they also just believed in you. So it was a great environment to just spur you on to learn. And every term that I did, I really loved. Honestly, except for surgery. I didn't really like surgery very much. Okay. Because as a junior doctor in surgery, you're really just like holding things for hours or just chasing up a CT scan or getting an X-ray. Yeah. In those days, we didn't have computers for that sort of stuff. So you'd physically be looking for an X-ray, walking around the hospital. That's like kind of your job. Yeah. So that wasn't so interesting. Having said that, even as a junior surgical resident, you would actually look after the patients in the ward, and you were almost in charge of their medical care. Okay. Because your registrar was busy in theatre. Yeah. But I loved everything.
So that changed your mind?
Oh, I loved it. I loved all of every job that I did. I loved it.
Okay, so from what point did you know you wanted to pursue psychiatry?
It was, I did my internship year in psychiatry. Yeah. Term. And what happened was my registrar actually quit in the middle of her training. She was a mature ager, and she'd come in as a GP doing psychiatry, and then she just had enough and then quit. Oh, wow. So what happened was in my second year, I can't remember exactly now, so long ago, but it was somewhere around my first or second year, they asked me to be the service registrar. And then I became a very young registrar, just as a service registrar. So in Australia, we have service registrars who are not training. were taking the responsibility, so it's consultant, registrar, resident or intern. And so I was that middle person, and I got that job and finished the term doing that job instead of doing my second year, instead of doing my other second year term. So because they just needed someone to fill in that job.
Yeah.
I had an amazing consultant, and he was just an amazing consultant. Shout out to Ken Orr. And he really inspired me. He was very kind, compassionate, very softly spoken. He's still working now. And he was very inspirational. He was great with medical students. He was a great teacher, and very caring, and thought very scientifically about what we were doing. It was just an amazing combination of science, humans, pathology. And I loved it. So I worked in Charlie's as a registrar. And then as a Christian, I was praying about what to do, and God spoke to me about psychiatry, and then from then on I knew. So by the time I finished third year, I went into psychiatry in fourth year.
Okay.
After finishing.
Yeah. So how long would you say is the process from start to finish of becoming a psychiatrist?
I think if you know that you want to do psychiatry from very early on, I'm not sure about the intake these days, but I remember that there were some even interns going into training, but usually it would be second year out. So if you do an undergrad in Curtin here, it would be 5 years, plus your internship it would be 6th year. And then if you knew exactly that you wanted to get into psychiatry, and if they took you in, because I think it might be a little bit competitive now, you might be able to get in your 7th year. And then you do 5 years of training minimum after that. So training is not as bad as it sounds. It's not like going to uni full time, right? It's just, it's like an afternoon a week. You're working at the same time, you're studying at the same time.
And you're earning?
And you're earning money, otherwise I don't think anyone would become doing any specialty you didn't earn any money for 12 years.
So,
but it would be, if let's say 5 plus 2 plus 5, I think the minimum would be 7 plus, so it'd be, I'm
12.
not very good at maths, but 12 years.
Yeah. Okay.
But it sounds longer than it actually is. I mean, but I think, if you had to go part-time for whatever reason for kids or whatever, it could drag out.
Yeah.
So it's a long training, but I enjoyed all my terms. I can tell you now, I loved all my jobs. One great thing about psychiatry is that the psychiatrists themselves, your supervisors, are generally super nice people.
That's good.
And very intelligent, very nice, and very supportive. Yeah. And the training program itself is super supportive because you have supervision every week with your supervisor. Yeah. Normally you spend like an hour with them, and that really helps you to stay emotionally well throughout the process. So I really, really loved the training. I just loved all of it.
That's good.
Yeah.
So even though it's a very long process to practicing independently, you need all of that because you need the experience and you need the.
Yeah, I think it's really strange coming out of med school and immediately becoming a psychiatrist.
Yeah.
I think it's kind of good, actually being a bit older now, I'm probably better at my job than I would have been in my 20s or even 30s. I think having a bit of life experience does help in this field. Yeah. Yeah. Especially in psychiatry, because you need to understand people from a bigger picture. So that's stuff that you can't really learn in uni. You can't teach someone what it's like to have a child, for example. Yeah. Like if you've got it's not that you have to have a kid to be a psychiatrist, but it does help to have experiences in life. In general. In a lot of fields, but psychiatry as well. Especially in psychiatry. Especially, yeah. Like, I mean, I think if you're doing like cardiology, having experience of having children is kind of useful, but it's, if you're going to be an interventional cardiologist, you're still going to. So if you could have chosen a different specialty, what would you have chosen? Yeah, I really liked. So one thing to say is that as a medical student, I think everybody at some point wants to become an emergency department doctor. It's because you feel like a real doctor, and when you're a medical student, you're just itching to do doctory things. Yeah. And ED is where you get to be like a real doctor. Okay. Or what you think is a doctor, right? Yeah. So I think everybody sort of at some point wants to be an ED doctor. But for me, I think. In terms of like specialties, I would have liked cardiology probably. I like cardiology. Yeah. And there were some other things that I would have been interested in, but I didn't get a chance to work in it. So for example, I did put my name down to do anesthetics, but never got a chance to try it out. So I don't know. I probably would have liked that.
Yeah. And what do you think of like psychiatry versus say neurology, or like
Ooh, I don't want to upset anyone here, but
like the differences or like similarities, because they're obviously both like about the brain.
Yeah, they're completely different. Look, firstly, okay, I don't want to. I could say some controversial things.
We'll just cut it out.
So I think, look, having not done neurology, it's very hard for me to say for sure. But one thing is basically the separation between neurology and psychiatry is artificial, and it comes down to we don't understand the psychiatric illnesses, so we don't have a neurological framework for understanding these conditions. Doesn't mean they're not actually neurological. So in other words, like something like depression, because it's so heterogeneous, the way we've basically lumped a lot of different disorders under the term depression. We probably did the same thing with schizophrenia, with a lot of our disorders. So we don't understand the pathophysiology of our illnesses very well. And I think that is an artificial distinction between the two specialties.
Okay.
It does mean though that the neurologists have a much better understanding of the anatomy, the physiology,
the function of
the function of why things go wrong in neurology.
Yeah.
And that means that they can be more precise in terms, hopefully more precise in treatments and all that. Having said that, I think, like I said before, one of the big myths about psychiatry is that our illnesses don't get better. Even though we don't understand a lot of the pathophysiology of psychiatric illnesses, on the whole, I think our treatments are pretty effective.
That's good.
So I think in terms of effect size for a lot of our disorders, we're really good at it. And so I think psychiatry actually has a lot of good treatments. I think a lot of neurological disorders don't have a lot of treatments as well. So I wouldn't say one is more effective than the other, but I think neurology, I think you can be more precise with the anatomy, with the physiology of your illnesses.
Yep.
But I think in psychiatry, we also have very effective treatments. So that's what I'd say about that.
And do you ever work with other kinds of doctors? Like, do you work with other neurologists when you're talking about patients, or
we have crossover a lot with sleep specialists who are respiratory specialists,
doctors,
neurologists, general physicians, and GPs. So in private practice, I write a lot of letters. There's a lot of letters to and fro, and so it's usually neurology, sleep physicians, like I said, and GPs that we write to, and then psychologists.
Okay.
So those probably are the main specialties that we'll be writing back and forth.
So it's good that you get to work with different kinds of doctors, and
you're not working with them, but you work alongside. So we share a lot of patients. Oh, and sorry, I should mention the chronic pain, the pain specialists.
Okay.
They would also, there's a big overlap in psychiatry.
Yeah. So what does a typical day look like nowadays for you?
I'm in private practice now, so I can set my own hours. So I'm probably not the best person to ask. So I just set my clinic the way I want it.
Yeah.
Probably a better, not the question is bad, but the typical working day of a public sector psychiatrist would be, because I've done that job before. That one was something along the lines of you'd start work at 9. You would do a ward round, so what we call a ward round with your registrar.
So walking around the ward in the hospital?
We would start with a paper round, so we would sit down, talk about all the different patients. You might have, let's say, 15 to 20 acute patients under your team, and then you decide which patients you needed to see that day as a consultant. And if you're very busy, you might have to split up with your registrar.
Yeah.
So then we decide, okay, I'm going to see this patient, you're going to see that patient. When you're looking after patients in an inpatient setting in psychiatry, a lot of them are under the Mental Health Act, so the psychiatrist has to be involved with making decisions about whether to keep that patient. They need to assess them themselves. So if there was legal work to do like that, then I would have to get involved. And then, so between, let's say 9:30 and 11 or 12, then you and the registrar, and then you'd have a resident, and then you'd have medical students, so it's a big team. You would then do the ward round and see the different patients from ward to ward. So you
Yep.
might get through 5 or 6 patients, and then after that you've got a visitor, I wonder who it is. And then you would, in the afternoon, split up and see the patients individually.
Yeah.
Yeah. So that would be and then at the end of the day, maybe talk about the patients, and you might do supervision with your registrar, and then some teaching.
Yeah.
With the med students, listen to case histories, and then once a week you might have a meeting with the other psychiatrist, and then once a week you have a multidisciplinary team meeting where you meet with the nurses and the psychologist, and you talk about all the patients. You do what we call a paper round,
Okay.
and that might be an hour or 2.
Yeah.
Yeah.
So how would you?
Finish at about 5:30 or 5.
Yeah, so it's like more or
So 9
less
to
a
5.
typical 9 to 5 job.
Yeah.
So you're not really
We
working
had on
at
call, so
night
you would
or-
do on call as well.
Yep.
And on call means that, as a psychiatrist anyway, it's very different. Another time I'll tell you about being a junior doctor. As a senior doctor, when you're on call, it means that they call you about, bigger things, because there's a registrar on all the time, so you get called by the registrar. You make decisions about bed management, that sort of stuff.
Yeah.
And then sometimes you have to come in to do forms for patients. That would be rare, but sometimes you'd have to come in and see a patient, and there could be any time of that night. But you take turns with the rest of with the other psychiatrists in the team.
Okay.
You might do that once a week,
Yeah. So
once every 2 weeks.
there's lots of variety in your.
Yeah, never
Good job.
bored. I always tell the medical students, you never get bored in psychiatry. It's never a thing.
And how did you find going from being a junior doctor or a medical student to suddenly being able to teach these people?
Well, you do teaching is all throughout medicine. That's something
Okay.
I love about medicine.
Mm.
So when you're an intern, you're teaching medical students.
Yeah.
When you're a resident, you're teaching, still medical students. When you're a registrar, you're teaching your intern and the medical student. And when you're a consultant, you teach everyone.
And it's a great way to learn.
Yeah. So I got a lot of my basic knowledge, hardwired in my brain because I taught it so many times.
Yeah.
That was probably
That's good.
Yeah.
What would you say are the most common things you have to deal with?
Now
Yeah.
ADHD is very popular.
Yeah.
Everybody's asking for ADHD diagnosis assessment. So I enjoyed that actually. That's really interesting.
Yeah.
And treatments are extremely effective. Standard depression, anxiety disorders, bipolar patients, and in private practice there are a few first episode psychosis or schizophrenia patients. That
Yep.
would be the bulk.
Okay.
And some autistic spectrum disorder. So that's super interesting. Those people are super interesting to look after as well.
Yeah.
And to diagnose.
Okay. So you don't ever have to do like night shifts or anything, just in your specialty.
As a
because
consultant?
No, not
Or
as
a junior
like throughout
trainee
your
doctor?
training. You have to.
Throughout training. Training was busy. So training, you would, depending on which hospital you're working at, you might have to work overnight. So it was pretty standard that we would do. So if you had an on-call shift, which might be once every 7 to 10 days, we would do. You would do 10 hour. You would do your typical 8 to 9 hour day, and then you would work pretty much through the night all the way to the next morning
Okay.
and to lunchtime. But you'd sleep for a lot of that time, so you'd have broken sleep.
Okay.
Yeah.
Yes, it's not pleasant.
It's just not great sleep,
Yeah.
but it could be an 18 hour. You got lost there.
Yeah.
But it could be up to it. Yeah, it could, like a 16. It sounds worse than it is actually, but it's like a 36-hour shift. But you
Yeah,
get
yeah.
breaks in between, like you go
Okay.
to sleep and then you
Eat
get
something.
called by the nursing staff, go see a patient, and then go back to your room.
Okay.
So you get to stay.
So
there.
you can just stay in your room as much as you need to. I mean, as much as
Yeah,
you're
yeah.
allowed to.
Eat like delicious hospital food. It's not delicious.
Yeah.
There's some hospitals where you couldn't tell the difference between the different meats. Seriously, like you'd be like, that chicken.
Is
or
it like
beef
the
or pork?"
patient food?
Yeah, that's what the area needs
okay.
as well. So you feel bad for
Ugh.
the patients. It's
Yeah.
disgusting.
Mm.
But yeah, I really enjoyed that. That was good.
So was it just adrenaline taking over at night? Or
Yeah, it was weird actually. When I come to think of it now, to stay in hospital overnight. And it was stressful because you're working. For example, when I was working in ED, and the crazy thing about training is that you do the hardest bits at the very beginning. So in first year, you actually get chucked into the emergency department, and you have to manage very acute patients in an emergency department setting, and then that's when we would see the patient, and you would stay overnight, and you could be working till 3 a.m.
Okay.
Sometimes you work through the whole night.
So would you say there were a lot of times you were really tired, or like?
They let you go home early the next day though.
Okay.
So it's pretty chill. I mean, compared to other specialties, like psych wasn't. But I have to say that compared to other specialties, the problem with ours is that if you're seeing a patient, it'll take you at least 2 hours to sort out. Like you can't see a patient for 10 minutes and go, I think it's conjunctivitis. You can't. You kind of like have to. It's a very complex issues and they're social issues. Then you have to. In the old days, we had to try to find beds for everyone.
Yeah.
So it was stressful. Yeah.
Okay.
But it was fun.
What would you say are some stereotypes about your career, or stereotypes about psychiatrists?
Is that right or wrong?
Both.
Okay. One of the stereotypes is people think that we can read people's minds.
Okay.
So yeah, we can only do that a little bit. No, we can't read people's minds. You still rely on people telling you things. I think the biggest one was that I've already said a few times already, which is that psych patients don't get better.
Yeah.
I think the other big stereotype is that psychiatric patients are strange or weird, which is so not true because, well, firstly, there's so many different types of psychiatric problems, so you can't really lump everyone in one.
And lots of people have these problems.
Yeah.
They're normal people like us.
Yeah. I won't even use the word normal. I think it's very common. Psychiatric problems are very common.
Okay.
In terms of like the psychiatrists themselves, a lot of people would think that psychiatrists are strange, and in all honesty, some of us are a little bit on the eccentric end. So that's true. That's probably a true stereotype, I would say.
Yeah.
Tweed jackets, corduroy pants, they're all probably true. Those are those that I can think of.
Yeah.
Psychiatric treatment itself, there's a lot of stigma about it. So ECT, for example, has got a huge stigma, which doesn't need to be there because it's a very modern treatment.
Yeah. So
very safe.
that's the other question. What kinds of hands-on treatments do you do, or is it just all listening to patients and like,
medicine?
Yeah.
So mainly medication and therapy, and then these days we do have TMS, which is transcranial magnetic stimulation, which can be quite effective for depression.
Yeah.
And then ECT. Those are the two.
So that's electroconvulsive
therapy, which is super effective for depression.
Okay.
Yeah.
Yeah. What hobbies do you like doing outside of your work?
Outside of you, I think you know my hobbies.
Well, you may as well tell everyone.
So I got addicted to online chess. I'm not that good at it, but I'm getting better. Yeah. And I like chess because chess, I don't know, it's just it's like a beautifully built game. It's an amazing game. I love music. I love playing the piano. I love worship music. I love gospel music, jazz. I love playing basketball. I almost forgot to mention basketball.
Oh no.
That's sad, isn't it?
Yeah, no.
3-point shooting. It's just my knees bunged up at the moment. So can't talk about basketball without feeling a bit sad.
Yeah. Okay. How would you describe?
But on that note, I think it's important to have hobbies outside of medicine because you don't want medicine to be your whole life.
Because that's what keeps you sane, I think.
I think you also need quite a lot of space in your life to reflect because you're dealing with some pretty heavy emotional stuff. Yeah.
Do you think a lot of people are not attracted, who are not attracted to psychiatry because it's emotionally draining?
Yeah, because they think, I'm not going to be. I don't want to listen to people's problems all day.
Yeah.
So it would be a typical thing. I think people would be thinking.
Okay.
Which is kind of true.
Yeah.
You are listening to people's problems all day.
Yeah.
But the thing is that if you can help them, that's great.
Yeah. Then you're solving their problems.
Yeah, I love it. I love spending time with my patients. It's really fun.
That's good. And how would you describe your family life or work-life balance? And how has it changed?
I have a great work-life balance.
How has it changed throughout your time in medical school?
Yeah, it's very different. So
doctor?
as a consultant in private practice, it's totally different from junior doctor days, totally different from medical school days.
Yeah.
I think it's important to know, one tip that I would give to younger people is, I think it's useful to see someone and go, I want to be like that person. Because I think that helps, not that you want to necessarily follow the path exactly, but to have a picture of the future. I think if you just blindly go and just do things without having any idea what you're trying to achieve,
it's really tiring. Yeah,
it's not a great idea. So I think I wouldn't say for most of us, for a lot of us in medicine, we got inspired to do what we do because we saw a consultant do what they do.
Yeah.
And that's really great in medicine because you actually get to work with those people before you make your decision.
Yeah.
And you get to work in that field. So psychiatry is not it's something that I actually worked in before I decided to do it. It's unlike a lot of other jobs, you don't get that opportunity with a lot of other careers.
Yeah. You just turn into that person.
I don't know many. I can't think of many careers like that.
Yeah.
So we get to actually work with the people. So so I think from young, I saw a lot of the specialties, and I would look at the consultant and go, oh, actually I don't really, I don't think I could ever, I don't want to be like that guy. And that's kind of turned me off that specialty weirdly.
Yeah, okay.
Because you can see how they live, you can see what sort of person they are,
yeah.
What sort of strain they're taking in their life.
Yeah.
And I just saw, and most of the psychiatrists that I knew were super happy,
very fulfilled in their work.
very good-humoured, funny people.
Yeah.
Yeah, they're really nice people. I think that's one benefit of psychiatry. All your I wouldn't say all, most of your colleagues are super lovely. Yeah.
And do you think doing medicine and psychiatry has made you a better person?
Made me better.
Like, has your personality changed or the way you relate to other people?
I think it's really hard to say because medicine is such a big part of my life. I don't know what it would be like without it. I'd say that the experiences, one thing about medicine is you get a lot of responsibility very young.
Yeah.
I think that was good for me, someone like me, because I needed responsibility to learn.
Yeah.
Without that responsibility, I don't think I could have learned very much at all. I think having heard so many people's stories, you really are very grateful just to be alive and to be healthy.
Yeah.
And also you understand the big picture. So especially in private psych, you see people from maybe 15, 16, all the way up to 85.
Yeah.
And you can see what life looks like
all
in the big
walks of
picture.
life, yeah.
And then you see where you are right now, and then you can start to project in the future. I think a lot of people, even when I was younger, you wouldn't think so much about 20 or 30 years ahead. You're very narrow-minded.
Yeah.
And you think, okay, I want this for the next 6 months or the next year. It's very hard to think 20, 30 years ahead. But I think psychiatry and medicine it forces you to think beyond yourself.
So you see a much bigger perspective.
Yeah. And you also appreciate how short life is.
Okay.
Yeah. Makes you think about eternity.
Yeah. Do you think it improved your communication skills or
Oh yeah, you
empathy?
talk to people from all different walks of life. You talk to angry people, sad people, anxious people, and you learn how to
relate
to anyone. So I've looked after people that are very poor, very rich, psychotic, manic, and you definitely learn. You have to.
Yeah.
Because that's your job.
Yeah, that's good.
So I love it.
What words of advice would you give to any aspiring psychiatrists or people going into medicine?
I think if you're a Christian, then definitely pray about it so you can know exactly what God wants you to do.
Yeah.
I think you need to. I think it's good to talk to people that are in the field so you really understand what the job is like.
Yeah.
And the whole training process, because it may not be for you. You may not want to do all that training. But I think, if you actually if you actually have the sort of personality for the job, I don't think there's one personality, but I think if you have the inkling that sort of nature to do psychiatry, then it's a very fulfilling career. I would warn against people who are wanting to do psychology or psychiatry because they have their own psychological or psychiatric problems. If you haven't sorted that out and you feel like you want to go into something to understand yourself better, it's probably not the best thing to do.
Yeah.
You don't want to be looking after people if you've got issues that you haven't resolved, and I think in that case you need to have therapy. It's good to get some therapy first before you sort of jump in there trying to save the world. If you've got unmet needs yourself or issues
definitely.
you haven't dealt with. So be aware of that.
Okay.
We ran out of questions.
Yeah. Do you have any questions for yourself?
Yeah. That's a very good one. That's what psychiatrists do.
No. Have you are there any big questions I've missed?
Okay,
if you could go into a different career outside of medicine.
Outside of medicine. Ooh, that's a good question.
Be a dinosaur.
Apart from being a dinosaur,
Why not?
I would have loved to be a musician.
Okay. Yeah.
I would have loved to learn jazz properly, play in a jazz band.
Yeah, that would be fun. And not law anymore.
Sorry?
Not law.
Now that I know a little bit more about law, I probably don't.
Not for you.
Yeah, not really me. I don't really like confrontation. I know there's different types of law, so
Yeah.
there's lots of different things.
Oh, I know something I did miss. Kind of going in circles here. But what kinds of areas of specialty in psychiatry can you go into?
Oh yeah, that's a good question. There's psychogeriatrics, where you look after older people. It's probably politically incorrect to say psychogeriatrics, maybe older age mental
Elderly
health.
people.
Yeah. There is forensic psychiatry.
Yeah.
And I did do a little bit of that work.
So that is to do
seeing
with
patients on behalf of the courts, or people that are in trouble with the law. That's interesting work. There is therapy, so you can sort of become specialized in doing therapy.
Okay.
So you can learn a mode of therapy and then just do more therapy. Child and adolescent psychiatry is where you look after kids and adolescents. We definitely need more of those guys.
Okay.
There's neuropsychiatry. There's consultation liaison, where you work with in a hospital and you get consulted by other specialties for psychiatric issues.
Oh.
Yeah, so that's interesting. That kind of crosses over with neuropsychiatry.
Yeah.
So within our college, I don't want to speak on behalf of the college because the college has got, you can look that up yourself, but the college has got different certificates that you can do.
Okay. And they each take.
And there's actually one called adult psychiatry, which is kind of what I'm doing, but I don't have the certificate for it.
Yeah. So does that take like a year or something?
Good question. I think you can. I'm not sure. I'd have to look that up. Yeah.
Okay.
So the certificates were just sort of starting to get. Some of the certificates were just sort of starting to come to being when I was training.
Yeah.
And in terms of like doing the other certificates, you do it as part of your advanced, what we call advanced training. So that's part of the 5 years normally.
Okay.
Whereas I just did generalist psychiatry, which I like.
And psychiatry is still very high in demand, you would say?
Very high in demand, particularly with all the ADHD referrals. Also, I think a lot of the disorders are chronic in nature, so you do need to have a psychiatrist involved a lot of the time for patients long term. So it's harder for psychiatrists to discharge patients outright.
Yeah.
And there's a lot of unmet need in psychiatry.
So even compared to other specialties still?
Oh, so I should mention there's addiction psychiatry as well.
Oh, right.
To mention,
So to do with addictions?
Yeah.
Yeah. So you would say it's not going anywhere in the future anytime?
Oh, no. Not going anywhere as in like it's...
Yeah, people aren't going to like go into psychiatry and then lose their job.
Oh, in terms of... No. I still remember a professor saying that to us. Don't worry about ever not having a job because you'll always have a job.
Yeah.
I mean, who knows the future, but I would hazard a guess to say that you will still need psychiatrists, 50 years from now.
Yeah.
Because there'll always be this field where we don't understand exactly what's happening. It's not neurological.
Definitely.
It's something to do with the brain, but it's not all brain.
Yeah.
It can't the interaction of the brain with the environment and your genetics. Yeah.
Okay. Anything else I've missed that you can think of?
I think. Yeah, I don't know. It depends on. Depends on what you want to
Maybe
know.
like if anyone has any questions, they can comment.
Yeah. Just leave a comment.
We can do another video.
We can do another video
talking through
answering
them.
these specific questions. I mean, there's so much to talk about.
Yeah, there's a lot.
I love it though. It's good.
Yeah.
It's a good
Okay.
feeling to be in.
That's good. Okay, thank you for your time. Bye-bye.
No worries. Bye.